What you should know about heel pain. Pain in the heels. It is crucial to comprehend heel pain. Heel pain is a very common ailment that many people suffer from. There are several possible causes for this complaint. Making the right decision is crucial. The cause of heel pain must be identified in order for treatment to be effective. That the proper treatment can be administered to the affected individual. What causes heel pain, then? The following are some of the most common causes. Heel pain locations. Plantar fasciitis is the most common reason. Fasciitis. Baxter nerve is another rare cause. Compression. Fat pad atrophy is a third reason for this condition. Achilles tendinitis is another cause. Haglin deformity is another cause. This fracture of the spine is another factor. Calcaneus. Tarsal tunnel syndrome is also a factor. The lumbosacral spine, and finally the sacrum. Heel pain is a common symptom of radiculopathy. The sights and sounds can clearly be seen. As a result of a variety of factors, there appears to be a link between heel pain and other types of pain. As a result, determining the source of the problem is difficult. This is the source of the discomfort, and it is this that causes the discomfort. Difficult or perplexing diagnosis. Plantar fasciitis is the most common reason. Fasciitis. Irritation and inflammation of the plantar fascia are symptoms of plantar fasciitis. The thick tissue on the body swells. Foot space. This fascia has the potential to become inflamed. Walking becomes more difficult because of the discomfort. The most severe cases of plantar fasciitis occur in the feet. When the patient stands up for the first time, the ground beneath their feet. The symptoms of startup pain are more severe. It persists with the first steps. Day's activities. Symptoms of pain will become more severe as time passes. Exercise that is prolonged. Or you could stand. There will be tenderness when it comes to the situation. Negative: the plantar medial heel. Sign of a nail. A plantar heel spare may be visible on an X-ray. The most common cause of plantar fasciitis is overuse. A heel cord that is tight. Night splints treatment. Physiotherapy. Silicone inserts for the heel cushioning. Achilles tendon cortisone injection. Stretching. Following that, we will discuss the Baxter nerve. The Baxter nerve is a branch of the spinal cord. Plantar nerve, lateral. The Baxter nerve is responsible for 20% of the total amount of blood flow in the body. This accounts for % of all cases of heel pain. Motor innervation is provided by the nerve. Enemy muscle, abductor digiti. When there is a problem with a nerve compression, it appears that the symptoms are. Plantar fasciitis is a condition that affects the soles of the feet. Between the ribs, the nerve runs vertically. The quadratus abductor and abductor hallucis. Muscular length. Then it forms a horizontal 90-degree angle. Beneath the surface of the water, a turn is coursing laterally. Innervation of the abductor by the calcaneus. Muscles of the digits. The Baxter nerve could be involved. Running athletes are afflicted by this, resulting in pain. The foot's medial plantar surface. Baxter nerve entrapment is fairly common. Misdiagnosed or unnoticed. What about fat pad atrophy? Fat pad atrophy, fat pad atrophy, fat pad atrophy, fat pad atrophy, fat pad. The calcaneus is cautioned by the pad, and fat is thinned in order for the caution of the calcaneus is no longer present. In the elderly, this is a common ailment. And it is capable of causing a great deal of discomfort. During a stroll. A history of steroid use is always present. Injection. Injections are frequently used in the treatment of a variety of ailments. Plantar fasciitis should be treated as soon as possible because it can lead to serious complications. Atrophy of the heel pad. Walking will be difficult for the patient. It hurts a lot. Central. Non-radiating. When the plantar heel pain becomes unbearable, it is time to seek medical help. When the patient is barefoot, he or she must resolve. In their toes, the patient walks. A central aspect of tenderness. Pad for your heels. Shoe modification for treatment. The heel should be padded externally. Achilles tendinitis is a condition in which the Achilles tendon becomes inflamed. For a period of time, the patient will be in pain in his ankles. It has been a chronic problem for several months. The patient will express his or her discomfort, and the tendon is thickened, causing swelling. Tenderness to palpation is present above the calcaneus's apex. Immobilization is often used as a treatment. Closed chain eccentric strengthening. Exercises. What about the deformity of Haglin? The insertional Hegelian deformity. Exostosis and calcification of them. The Achilles tendon is inserted. Usually, the patient is seen by anti-inflammatories and physiotherapy. Medication. Injecting through the tendon is not a good idea. Around the tendon injection. If the symptoms last longer than 6 months, consult your doctor. After a few months, surgery could be required. The removal of the wrangling exostosis. Calcification of the incisional area. If more than half of the population. To remove the Achilles tendon, it is separated. Superior calcaneus, posterior. When a tendon is prominent, it weakens and should be fastened to the animal's backbone. Suture anchors on the calcaneus or a tendon. Bridge the gap with a transfer. For as long as flexural hallucis. A tendon used in this. As a result, the operation will be a success. Debridement of calcaneus Achilles tendon. As far as exostectomy and flexural hallucis are concerned. Especially if the tendon transfer is long. The degeneration of the tendons is more severe than the degeneration of the muscles. 50. Web-based. The calcaneus can be fractured by stress. Overuse injuries are to blame. Heel pain is a common complaint. Weight-bearing discomfort. When you walk, the pain gets worse. Running. Throughout the day, the pain does not lessen. Every day is a struggle, and each step hurts. Medial to lateral pain is more prevalent. The heliconiaa tuberosity has been compressed. It is possible that an X-ray is normal. To diagnose, we may need MRI. The calcaneus stress fracture. Boots or a cast are the treatments. Immobilization. Paresthesia of the tarsal tunnel syndrome. Symptoms of plantar numbness in the feet are exacerbated by physical activity and the patient may be awakened by paresthesia at any time during the procedure. Night. There are numerous factors that contribute to the posterior tibial nerve is compressed. Ganglion cysts are one of the nerves. This is a well-known cause of tarsal tunnel syndrome. MRI, magnetic resonance imaging, is a good way to find out if the patient will have a positive response and a positive outlook. A favorable outcome for the country's accession. The patient's ganglia may be affected. Symptoms of tarsal tunnel syndrome are no longer present. Radiculopathy of the lumbosacral spine. Pain on the lateral side of the foot can be caused by a variety of factors. S1 herniated disc as a result of LD5. Radiculopathy will result from this. The nerve root of the estruan nourishes the foot's lateral aspect. Pain on the lateral side of the foot can be caused by a variety of factors. Caused by a herniated disc in La5-S1. Involvement of the S1 nerve root leads to. On the one hand, there is less sensation and pain, and on the other hand, the foot's lateral aspect. Thank you so much. I hope it was helpful.